Greetings. My name is Dr. Lenin Olivera-Figueroa. Today I'll be sharing with you the findings of a research study conducted last year, 2020, alongside my collaborators, Alexander Unger and Julie Papastamatelou. The title of this presentation is Assessing Psychosocial Barriers and Facilitators of SARS-CoV-2 Vaccine. Over 24 million individuals from 144 countries have been affected with the severe acute respiratory syndrome coronavirus 2 pandemic, also known as COVID-19. This pandemic has severely affected the world's economy and healthcare systems. The most promising method of intervention for COVID-19 is a vaccine. Thus, the global crisis caused by the COVID-19 pandemic has led to an unprecedented race to develop a vaccine for COVID-19. Nonetheless, little is known about how accepted would this vaccine be in the community once it is available. Thus, it is important to address psychosocial barriers and facilitators of COVID-19 vaccine uptake in the community. Because of that, the purpose of this cross-sectional study is to examine psychosocial barriers and facilitators of COVID-19 vaccine uptake in the United States of America. In terms of methods, the participants for this study were recruited through the online platforms Prolific as well as Google Forms. And the final sample consisted of 236 participants, of which 101 were males, 133 were females, and 2 who identified themselves as non-binary. In terms of mean age, that was about 31 years old in this study. In order to assess predictor variables on the study, several questionnaires were administered. The first of which was the short version of the Zimbardo Time Perspective Inventory, validated in the United States of America, which measures the standard time perspective constructs of past positive, past negative, present fatalistic, present hedonistic, future, as well as the deviation of balanced time perspective coefficient. In addition to that, we also administered the consideration of future consequences scale, as well as the COVID-19 conspiracy beliefs questionnaire, which differentiate conspiracy beliefs into 2 different indexes. One, the name hoax, which refers to the belief that COVID-19 is a hoax, and another index named bioweapon, which refers to the idea that the COVID-19 pandemic would be based on a bioweapon. In terms of outcome variables, for this study, the formal outcome variable was constructed through an index based on the theory of planned behavior scale. For this study, that was operationalized as willingness to be vaccinated. As we see on this image, the theory of planned behavior suggests that attitudes, subjective norms, and perceived behavioral controls all exert influence on the intention of individuals to engage in some behaviors, in this case, a vaccination. Hence why we chose this to be the outcome variable for this study. In terms of statistics, for this study, we conducted multiple regression analysis. This analysis yielded 7 models. Of these 7 models, the 7th and final one provided the best model fit. That was determined because the R-squared change was of 0.026, and this was statistically significant at a level of 0.006, as well as the largest R and R-square values, with the R being of 0.528 and the R-square being of 0.278. In terms of gender and age didn't reach any significance on this study, but gender did show a differentiation, which was addressed in the results. In terms of formal results, men scored higher than women on this study on the theory of planned behavior index, and this was statistically significant at a level of 0.026. In terms of time perspective, past positive predicted decreased scoring on the theory of planned behavior index, and this was statistically significant at a level of 0.004. Conversely, Past negative predicted increased scoring on the theory of planned behavior index, and this was statistically significant at a level of 0.002. The deviation from balanced time perspective coefficient, DBTP, predicted decreased scoring on the theory of planned behavior index, and this was statistically significant at a level of 0.003. Along these lines, consideration of future consequences, CFC, predicted increased scoring on the theory of planned behavior index at a level of 0.006. Regarding the conspiracy beliefs constructs that were addressed on this study, as I mentioned, conspiracy beliefs were differentiated into the belief of in COVID-19 being either a hoax or a bioweapon. Only the hoax index reached significance. In this case, predicting reduced scoring on the theory of planned behavior index. And this was statistically significant at a level of 0.000. In summary, COVID-19 vaccination facilitators were identified on the study included being of male gender and having a robust past negative time perspective tendency, and the consideration of future consequences construct. In terms of the COVID-19 vaccination barriers observed on this study, these were the past positive time perspective tendency, the deviation from balanced time perspective coefficient, and the belief in COVID-19 as a hoax. In terms of conclusions, past negative time perspective and consideration of future consequences may facilitate COVID-19 vaccination as a preventive reaction, perhaps caused by previously having experienced illnesses similar to COVID-19, such as influenza or H1N1. Past positive time perspective may serve as a barrier to COVID-19 vaccination due to unassertive optimism, which may minimize beliefs in the severity of the COVID-19 pandemic. The deviation of balanced time perspective coefficient may serve as a barrier to COVID-19 vaccination due to the predominant fatalism and negativity associated with this time perspective profile, which may cause inertia towards willingness to vaccinate for COVID-19. Also, belief in COVID-19 as a hoax likely serves as a barrier to COVID-19 vaccination due to the incredulity these beliefs promote in individuals about the COVID-19 pandemic. Therefore, it is important to develop health promotion campaign strategies that can effectively increase consideration of future consequences in the population, as well as address time perspective and misinformation caused by conspiracy theories. With this, I conclude the presentation. For anyone that may have any inquiries about this study, feel free to write to me at my email, which is my first name, Lenin, dot my last name, Olivera, at aya.yale.edu, or reach me at my phone number 1203-606-9450. To conclude, I thank everyone for your attention, and I please stay safe, and I look forward to see you as soon as possible. Have a good day.